Thank you very much for joining me today. My name is Jack Perkins. I'm an emergency medicine physician. I work in Roanoke, Virginia. Today I have the pleasure of talking to you about adult CPR and AED education. I am the founder and current executive director of the Compress and Shock Foundation, and this is our 4th annual CPR and AED Education Day. Originally this was planned to be in May of 2020. Unfortunately, because of COVID, we've rescheduled and now it's October 17th. And we have recorded this just in case there's any issues in terms of delivering a live presentation. The Compress and Shock Foundation, you can find out a lot more about us online, compressandshock.org, but we are committed to providing free CPR and AED education to the public. Again, never charging anybody anything because we believe this is a life skill. We're going to push this through and hopefully in the next 10 years have a national celebration of these skills every 3rd Saturday in May. So hopefully you'll join us every May to get a refresher on these skills. Unfortunately, a lot of people think that cardiac arrest is something that is not going to be them because they're young, they're healthy. When they have in mind somebody that they're thinking about who is at risk for cardiac arrest, they're generally thinking somebody who's older, somebody who smokes, maybe diabetes, somebody who has high blood pressure or a previous heart attack. The reality is it really can be anybody at any time and anywhere. And the only thing that is really going to save a difference is bystander CPR and defibrillator use. If you witness somebody who has a cardiac arrest and you wait for 911, the opportunity to save that victim's life is going to be lost. It's really the only medical emergency where simply calling 911 is not sufficient. So we're trying to change culture and empower the public that they must intervene, that those 4 to 6 minutes or longer waiting for 911 is not going to be sufficient. So this is a survival story. Our survivor this year is Joel Byoff. We're going to take a minute to watch his testimonial about him surviving cardiac arrest in the Southwest Virginia area.
Good afternoon. My name is Joel Byoff and I'm a certified registered nurse anesthetist with the Carillion Health System. In this very room about 1.5 years ago, and it was actually February 4th of 2019, I was doing all the right things, trying to stay as physically fit as I could, working out every morning, exercising before work at about 10 to 6 in the morning, and on a treadmill that's right over there, I had a sudden cardiac arrest and went down on the ground. One of my colleagues happened to have been working out next to me and immediately got on my chest, called a code procedure, and within minutes the emergency department came down and continued with advanced life support. This happened on Monday, and on Thursday they woke me up with no brain damage, and I am here now 1.5 years later, still giving anesthesia with no residual problems at all because someone got on my chest right away.
Hi, my name is Ethan Byoff. I'm this guy's son. As he said, it was February 4th. It was a pretty brisk and cold day, and I was taking our dog back from a morning walk when I am told that when one of my mom's friends comes in, she says that he had passed out. Now, I don't exactly know how, I didn't even know why it had happened. I was just told he had passed out, so we immediately go to the hospital, and I figure, okay, if he just passed out, we'll check on him and I'll go back to school. I didn't realize that his heart had stopped, and it was one of the scariest, most hopeless feelings I have ever had, because I really love him and family is really close and important to me. Every time I think back to that day, I can't describe how thankful I am that someone was in here and able to immediately start CPR and get him back until the immediate attention could be given to him, professional attention, and it's indescribable. It's just a wonderful feeling, and Words can't describe how thankful I am.
I cannot stress the importance of the ability of lay people to be able to get on the chest when someone goes down in public, or especially outside of a hospital setting, because I was extremely fortunate that I actually had my cardiac arrest in a hospital. But for everyone out there that has cardiac issues, cardiac arrest, and problems outside of the hospital setting, the Compress and Shock Foundation is trying to teach people to get on the chest and start compressions as soon as possible. More and more lives can be saved, more and more brains can be saved, and there will be more success stories such as myself. Thank you for listening, and I just thank God that I'm here to be able to tell you about it today.
COVID-19. Absolutely have to take some time this year to talk about COVID-19 and its impact on cardiac arrest, and how does it impact potentially any rescuers who would be going to the aid of somebody who's experiencing cardiac arrest. COVID-19 transmission. If there have been some studies out there that suggest that COVID-19 is not high-risk transmitted from a victim of cardiac arrest to the rescuer. These early studies came out of Italy as well as from in Washington State earlier in the spring of 2020, suggesting that the risk is very small to a rescuer. However, one of the things that we are doing for our learners this year is everybody who's coming to our event is going to get a Ziploc bag to keep in their car with 2 surgical masks like you see here. The idea is that if you have any concerns, once you start your 3 C's, which we'll talk about in just a second, you will take time to put a surgical mask on yourself and on the victim before you begin your chest compressions. We don't want there to be any barriers to providing CPR to that victim because we know that's going to save lives. But in summary, it's very low risk. Unfortunately, what we do know is the numbers have changed. COVID has negatively impacted cardiac arrest. There's a study that came out this summer, basically said that EMS response times have gone up. That's not surprising in terms of it's going to take them longer to get there as they're putting on their personal protective equipment. The likelihood of bystander CPR has gone down. Again, that's probably because of some understandable reluctance of the public and not understanding that COVID is very unlikely to be transmitted in this particular scenario. We have decreased survival to hospital discharge, and unfortunately the increased risk of cardiac arrest. There is some data showing that COVID-19 is increasing the likelihood of not only heart attacks but also cardiac arrest, and not just in the old. It is also older people, it is also in younger people as well. Today we're going to talk about a number of things. We're going to talk about cardiac arrest. We're going to talk about the difference between heart attacks and cardiac arrest. It's a very important distinction to make so that you understand the difference and understand that everybody who has a heart attack does not suffer cardiac arrest. We're going to talk about when to perform CPR. We're going to talk about defibrillators, automated external defibrillators as well. They're out in all over the place in the public, why they are so crucial in terms of saving a life and why CPR is paired appropriately with the use of a defibrillator if one is available, and CPR is continued until the defibrillator is brought to the victim's side. We'll talk about how you can save a life and why this is so, again, reinforce why this is so important for a bystander intervention. I said this before, but I'll say it again in terms of this is the one medical emergency that just simply calling 911 is not enough. Bystander intervention is absolutely critical. So we teach the 3 C's, and we'll go over this again in the hands-on training. Check, call, and compress. You're checking for responsiveness. If the patient is unresponsive and has an abnormal breathing pattern, you're calling 911. Then you're going to start compressions. This is really important because you want to minimize any interruptions in compressions and get on the chest as soon as possible, beginning those chest compressions to start circulating blood flow through the arteries surrounding the heart as well as very importantly to the brain, which is very susceptible to a lack of blood flow. So we'll talk about the 3 C's as our foundation for providing CPR. Right now, in the best case scenario, and we're talking the best area in the country in terms of providing optimal outcomes, is in the northwest area of this country, up in the Seattle region, Seattle, Washington, where they have survival rates that are exceeding 10%. All told in the country, chance of a victim surviving out of hospital cardiac arrest is actually less than 10%. But for the purposes of this explanation, we'll say 10%. So this graphic represents a 1 in 10 chance of survival. So victim has cardiac arrest, their chances of leaving the hospital with intact neurologic function, meaning they have not suffered a devastating brain injury, is 1 in 10. However, if every victim of out-of-hospital cardiac arrest received bystander CPR and an AED was used as soon as it was available, now you're looking at 3 in 10. So a 30% chance of survival. So 1 in 3 victims would actually walk out of the hospital and resume their life if every one of them got bystander CPR and early AED use when it was available. Looking at the numbers, we have roughly 350,000 cardiac arrests per year in the United States outside of the hospital. If we went from 10% to 30% survival, now you're talking almost 70,000 lives that could be saved outside of the hospital, people returning to the families, returning to the community. Tremendous potential in terms of opportunity to save lives here. We have to talk about cardiac arrest in terms of what is it and making sure that we understand the difference between cardiac arrest and a heart attack, because a heart attack does not necessarily mean the person's heart will stop. Cardiac arrest, the blood is going to stop flowing through the heart. The patient is likely to have sudden collapse, and they're going to have an abnormal breathing pattern. It is possible some seizure-like activity might be seen. Keep in mind that most people think of seizures, they think of a brain problem, but a lot of things can cause seizures. It doesn't mean the problem is coming from the brain. In fact, a lot of people who witness an out-of-the-hospital cardiac arrest will describe seizure activity from the victim, which is simply because of a lack of blood and a lack of oxygen to the brain. A heart attack is caused by a blockage of blood supply to one of the major arteries that supplies the heart. Most people who have heart attacks do not have cardiac arrest. They are very different. However, some people who have heart attacks do suffer cardiac arrest. Major differences, I think this slide illustrates it nicely. Cardiac arrest, the person will be unconscious and either not breathing or breathing abnormally. Person with a heart attack will be conscious and they will have a normal breathing pattern or talking. Very, very important distinction. Now we're going to take a look at a video that illustrates this. This is a video from 35 years ago, roughly. This is a famous basketball player in college, Hank Gathers, who unfortunately suffered cardiac arrest and died on the basketball court. One of the things you will see in this video is him actually having seizure-like activity, which is exactly what we were just talking about that is common with cardiac arrests. CPR is cardiopulmonary resuscitation. Now, it's very important to think about the pulmonary part. Even though it's cardiopulmonary resuscitation, we no longer do rescue breaths. Why is this? Because the average person who suffers a cardiac arrest, when they go down, they have at least 5 minutes of oxygen reserve. So it is not necessary and actually harmful to them to provide rescue breaths. It's harmful because you're taking away from what they need, which is quality chest compressions when their heart has stopped. So continuous chest compressions is what they need to circulate the oxygen that is already in there. So for 5 minutes, they don't need any supplemental oxygen. One of the reasons why we do this education in terms of why do we do a PowerPoint, it is really important for the public to understand the importance of CPR and to break down some of the barriers or myths from CPR that prevent bystanders from intervening. So I think it's important to go through these individually. The first one is contagious diseases. So we used to talk about HIV, hepatitis. Of course, these days in 2020, talk about risk of COVID. We don't do mouth-to-mouth anymore. As I just said, it is not recommended and potentially harmful to the victim. Now, we're talking adults. Infant and child CPR is very different. Rescue breathing is still part of that, but that is not for this particular presentation. We're talking adults. We do not give rescue breaths for these victims, so no worries about contagious diseases. Lawsuits. Every state in the United States, all 50 states, have a Good Samaritan law that is in place that makes it impossible for a lawsuit to be successful against somebody who is intervening in good faith to that victim. So in fact, there's actually been recent legislation that would suggest that a bystander who does not intervene may actually be at higher risk of a lawsuit from not intervening than they are from intervening and potentially causing harm. Very interesting in terms of the shift. But either way, it's important for you to understand that there is no risk to you intervening in good faith on that victim and trying anything, because keep in mind that victim is dead. Anything that they received in terms of cardiopulmonary resuscitation offers them a chance of survival as opposed to sitting there and watching them. Hurting someone, it is important to understand that CPR is a very aggressive, in fact, violent maneuver. Breaking ribs is often a part of cardiopulmonary resuscitation. It is normal to break ribs, and this is expected. As an emergency medicine physician, this is something that we expect during the course of cardiopulmonary resuscitation. This can be managed and is not necessarily something that should at all be a consideration. It is very common when performing chest compressions to hear ribs breaking from time to time. It should under no circumstance cause the rescuer to think about stopping, that they're hurting somebody. Keep in mind that person is dead. Providing them chest compressions is the only chance you have to restart their heart. This is another story, because oftentimes when we're teaching, this is our 4th year of teaching, we hear somebody says, like, I don't have the muscle mass, I'm too old, I'm too young, I can't save a life. This is a wonderful video showing that even 9, 10-year-old children can save a life of somebody else when they learn CPR. The age at which we're teaching is 13 and older, but there are sometimes absolute exceptions when kids younger than 13 can provide CPR and save a life. So being too thin, too old, not being able to do this or that is never an excuse that's appropriate for not trying to intervene and doing something for the victim that is on the ground.
Me and Bailey are gonna show you what CPR is.
The 6th grade classes at Orchard Elementary were a little different today.
And push down 1, 2, 3.
11-year-old Skylar Berry is adamant everyone should know CPR. She's teaching her classmates the very easy method of hands-only CPR.
1, 2, 3.
Doing just compressions to the beat of...
Stay alive, stay alive.
She and her friends have even started a CPR club, cleverly called Staying Alive.
It can happen any second or any time. They could be choking on food to drowning in a pool.
But why is an 11-year-old so laser-focused on CPR?
Thank you. This is the fire department. What is the address of the emergency?
He's not breathing.
Because at a birthday party on Sunday,
He was gone, like right in front of all of our eyes. We lost a friend.
the kids were playing in this pool in Antelope when they realized...
As he got deeper, we noticed, and my friend Manuel was like, he's not playing around, I know my friend. I checked his pulse and I was like, there's no pulse. So I started the CPR.
I thought he wasn't going to make it. I thought there was going to be a death.
David Baltzley was the birthday boy.
It was pretty cool. I mean, I've never seen an 11-year-old do CPR on another kid. It was just so relieving.
Relieving because...
Is he okay? They want to know if he's breathing. They got him awake. Okay, he's awake.
He is one of their friends and is a little overwhelmed by the attention, but he was back in school on Monday and is just fine.
I just started crying. I was so proud. I couldn't believe it.
Marissa is Skylar's mom.
And I asked her, I said, how did you know that? And she says, Mom, fire camp, duh.
Fire Camp is a summer camp put on by Metro Fire teaching kids fire safety, CPR, and more. Skylar is the one in the blue shorts. She learned CPR right before school started.
You cross it and go down.
And now she'll spend whatever free time she has this school year teaching others to save lives.
Real life situations are serious. It's not time to mess around.
So again, when we talk about CPR, we talk about the 3 C's as the foundation behind what you're doing. Really important to think about this. The first one is checking the victim, okay? When you check the victim, one of the things that you're doing is you go over and you're aggressively tapping them. Hey, are you okay? Are you okay? If there's no response, the next thing you're doing is observing their breathing pattern. One of the things that we teach, and keep in mind, we don't do pulse checks anymore. Pulse checks are not reliable, so we look at breathing pattern. And your question that you're asking is, that victim's breathing pattern normal? If it's normal, it looks like they would be breathing when they're sleeping or even just at rest on the couch, you do not need to do CPR. If they are not responsive and their breathing pattern is anything but normal, they need CPR. So what I'm also saying is that it is possible to be in cardiac arrest and still be breathing, but it will be abnormal. It may be gasping breaths, it may be snoring breaths, it may be gurgling, but it will not be normal if they're in cardiac arrest, and oftentimes they are not breathing at all. So you check them, you check for responsiveness, you check for breathing to see if it's normal, and if they are not breathing or they're not breathing normally, you call 911, or if you're with somebody else, they call 911. The next thing you do after activating 911 or having your person next to you activate 911 is to begin CPR immediately. And once you begin CPR, you do not stop until somebody relieves you, if you have 2 people, or EMS arrives and they can take over care. So importantly, it's not only beginning CPR, but it's also quality of CPR. So you want to, when you're looking at CPR and you're looking at this mannequin, what you want to do is take one hand, place it in the middle of the sternum on the lower part of the sternal wall, and that is between the 2 nipple lines. So in men, between the 2 nipples, in women where the mid-center of their sternum would be and the nipples would be if they were lying flat. You put your palm down in the middle of the sternum, you take your other hand, interlace your fingers, and you're going to direct the force from your torso down, straight down over their sternum, okay? You don't want to be far away because you don't have that much force. You want to be directly over the chest, directing your force from your torso down onto the victim's chest. You notice that my fingers are interlaced and also that my elbows are locked out. The reason why my elbows are locked out is because if my elbows are not locked out, I am only using my arms, and this is just becomes an upper body workout, and that's not that effective, and you will tire very, very quickly. So lock out your elbows in the middle of the sternum, in the mid-nipple line. Importantly, other things to consider. You want to do at least 100 compressions a minute. Something you may have heard of before is having a song that has a beat of 100 beats per minute, which is staying alive. So staying alive. That song, if you hum it in your head, that will give you 100 beats per minute, which is 100 compressions per minute. Also importantly, because you think about what are you doing when you're doing chest compressions, you are physically compressing the chest. What you're actually doing is you're creating a vacuum. So you're actually changing the pressure inside the chest cavity. So blood is literally being sucked through the chest cavity. That's why it's important to go 2 inches deep and allow recoil. So if you go 2 inches down and allow recoil, you'll allow that maximum change in pressures to get blood circulating through the heart, which is exactly what you want to do. So 100 times a minute at least, 2 inches deep, and allow full recoil. We'll go over this in the hands-on portion in detail. So again, 2 inches deep. This very nicely illustrates exactly what I said about timing. If you sit there and you watch and you wait for EMS to arrive, every minute that goes by without intervening with cardiopulmonary resuscitation, the chance of survival goes down by 10%. So you can see very quickly with the average response time in a city of 4 to 6 minutes, longer during rush hour, that you may be getting down close to a 0 chance of survival very, very quickly by the time EMS gets there. So this very nicely says like your ability to impact survival is by getting on that chest immediately and by making sure that you don't stop until somebody relieves you or EMS arrives. Worst case scenario, you call 911, and when you call 911, they can always walk you through it. Even if you've forgotten anything, they'll talk to you about chest compressions and keep you on the phone until EMS arrives. Why do we do chest compressions and why do we do CPR? We do that to try to shock the heart back into a normal rhythm, and we do this with defibrillators. What I have here is an automated external defibrillator. This is a real one. This is the one that we have here in our gym. Basically, they are all made to the same standards. That you will see these in supermarkets, in malls, they're on airplanes. You'll see them all over the place, and they are all made to the same standard, such that if you take it off the wall, you take the cover off, it should be easy enough for anybody to just look at it, hit the on button, and follow the directions. Most of them come in a very similar format where you have the 2 pads here that are attached to the device. The pads show you exactly where they are to be placed on an adult, or if they're pediatric pads, which is a child pad, they will show you where those are placed as well if they're pediatric pads. All you have to do is hit the on button. The on button will be very visible here, and then the AED will start talking to you and you follow direction. It is really that simple, and we will go through this in detail when we do the hands-on training. A few important things to talk about with the AED to make sure that you understand it. When you open it, you just follow the voice commands, just as I said. All it's looking for is 2 different heart rhythms. One is ventricular fibrillation, the other is ventricular tachycardia. It will only shock those 2 heart rhythms. You could not put this on a person that is healthy, walking around, and think that it's going to shock them. It only shocks them if they need it. You can't possibly harm somebody. If no shock is advised, it means that CPR is that much more important because your goal is to get them to a shockable rhythm. Your CPR is a gateway to getting them shocked back into a rhythm that is going to make their heart work normally. As I said, you cannot hurt yourself or others. It is not possible. The only way that you could harm somebody with an AED is by not taking it off the wall and putting it on the victim of cardiac arrest. A couple important things to think about. Number 1, in the top right corner here, you can see a medication patch. If you see a medication patch, use gloves to take the medication patch off, or make sure that you just at least don't put the AED pads over top of the medication patch because it could cause absorption of that medication. Number 2, in the middle, you see a gentleman here with quite a bit of hair on the chest. Sometimes that can make the pads difficult to adhere to the chest. So you have 2 options. A lot of the AEDs come with a razor. You can shave that very quickly. A lot of the AEDs also come with 2 sets of pads. What you can do is take 1 set of pads and literally use it to wax the area where you're going to put the pads on, take that off, and now you've cleared an area for the 2nd set of pads. Finally, you see in the top left corner here, underneath the skin, it looks like a deck of cards. That's an implanted defibrillator that has a wire going into the heart. It is not a contraindication to use a defibrillator if somebody has one of these in place because they may not always be working properly. You may absolutely put a defibrillator pads on them, just don't put it directly over the defibrillator underneath their skin. So, to recap, CPR is easy. This is the way that you're going to save the life of somebody in cardiac arrest, and it is so important that bystanders become involved. We have learned over the past decade or more that the only way we're going to push numbers past 10% is with bystander involvement so that every victim receives bystander CPR and AED use when one is available. It's super easy to do, it's easy to learn, and that's why we're teaching it here free to the public. This video that I'm going to show shows an optimal response to cardiac arrest. It is absolutely perfect. It is a witness cardiac arrest, very quick CPR, very quick AED use, and the outcome that is exactly hoped for and expected with that quick of a response.
We had 2 games that night. I was in a lot of pain, which I was used to because I'd been playing in pain the entire season.
You could tell that she was laboring somewhat, but Claire just has the heart of a champion, and she's just going to keep playing.
I was sitting at the scorer's table, keeping score for the game, and I just heard a loud thud.
I think we just started yelling for help.
Yeah, yelling 911. You have a feeling of helplessness.
And it was very quickly that there was people there with us, very quickly.
She fell about right here. Starting back in 2006, our school got the first AED. As part of that training, we would come together and we would have drills unannounced. Because of the code blue drills, there were some things that were just instinctual to me. The AED is literally right outside of those doors. Go grab the AED, bring it back, and get to work.
You really can't describe just the fear you had going through your mind.
It really looks like they were running a drill, that it was so quickly that people were to Claire and that they were taking care of her, and it was amazing.
She was in VFib, and so the only thing that would bring her heart back into a viable rhythm was to have a shock. The AED was needed in order to bring her back to life.
It's complete joy seeing her revived.
I'm just really thankful, and I feel really blessed that this is where I was chosen to go to school at, and just really thankful.
We know that God created her, and He knew about this moment before it happened, and He knew who would be here and what the outcome would be, and then what we would be responsible to do going forward to share her story. Well, we wouldn't let our child participate in a sport anywhere at this point if there wasn't an AED machine accessible. Waiting until someone's gone is not a good time.
Again, we're going to highlight the 3 C's when we get to the hands-on training. And I encourage you to check out our website and certainly contact us if you have any questions. Again, I'm Jack Perkins. Thank you very much for your time.